that help?
Well, I think having Irene be a part of the process and having our residents adjust and become a part of the facility is that they need time to do that. And so they need someone to be that bridge and that they can relate to and have a chance to just kind of not just explore what's ahead of them, but look back a little bit as well. And so that's the process that reminiscing does for them. It gives you an opportunity to maybe grieve a bit for what you've lost and put that behind you and then go forward from where you are. Volunteers off the street for facilities like nursing homes are wonderful, and we depend on them and we appreciate them so much. But they are not always attuned to the different levels of mental status that you have in the building, and so it takes a certain approach, and you need to be able to see what approach that is, and it takes a bit of training and some experience under your belt to be able to to not necessarily take what's being said or what's happening on the surface, but look maybe beyond that, like, well, maybe this person's really upset because they're cold, or they're hungry, or they're not understanding what's going on. Too many people around them. They need a different environment. They're overstimulated. So it takes someone with a little bit of training and some background to be able to look just beyond the surface and to do some troubleshooting. Irene's been working with a higher level of residents that we have at the nursing home. And so many of our activities and our time is spent with our lower functioning folks. And so there's a gap, I guess you'd say, in what we typically offer, and they're the ones that are the highest cognitive level are often kind of left on their own. And they need something so totally different than what the rest of our residents need. So Irene's been able to provide them with I guess the right environment to feel like they can express themselves without stepping on anyone's toes, be honest in what they're feeling, and and to be able to vent in a way that they might not be able to vent to someone who's providing care to them on a daily basis. That's a different relationship than someone who's coming in as non-judgmental, not in a hurry, that has some training behind them so that they can help them work through the hard times that they're having. So that's where Irene has really been. Having a trained gerontologist, someone that is their specialty, can actually pay for itself hand over fist, because so much focus with state now is that you want to avoid behaviors and handle problematic folks in such a way that you're not going to drugs or physical restraints with them. And if you have depression, that often leads into behaviors which can trigger a hospital stay at a psych facility and more medications, and then that leads into all other kinds of issues like fall risks and things when they're heavily medicated. So to be able to be proactive and before those issues arise is well worth the amount of money that you might put into having someone trained to come into the facility. Having Irene in the building has just been a blessing, not just to me, because she's so helpful and she can walk into a room and just see what needs to be done, whether it's assisting with passing out articles for a meal or an activity or something, and she's in their eyes a friend, because she always has time to give them that personal comment, that touch. And so on the surface, she's a friend to them, someone new, a visitor, and everybody likes to have company. So that's the how they view Irene, not as a professional coming in to help them through a problem, but as a friend that's going to walk them through this process.